Joe, I'm a sports physical therapist, a licensed sports physical therapist. Graduated a few decades ago in '82. I immediately wanted to be an independent physical therapist, having my own private practice, which I did from the first day. I come from basketball myself, and so I got integrated in sports, competitive sports and professional sports, mainly basketball and professional tennis here in Belgium. And so, I had a private practice with different colleagues. It grew and it grew. And at a certain time, you try to focus on something else. So I started focusing on everything what has to do with recovery modalities. And as you know, different modalities in the market. Cold water immersion is one of them. Infrared sauna or sauna use is one of them. But of course, the latest ones are the cryo chambers and the photobiomodulation or the red light therapy, the compression therapy. And so for me, it has always been very important to understand more what we as a physical therapist are doing. What kind of treatments are we giving to our clients, to our patients, and to our athletes? And also, especially when it comes to the recovery modalities, I found out very fast that when it comes to safety and when it comes to efficacy, it all has to do with the technology. And many of those applications are company driven. And for me in the US, they're popularity driven, and they forget about the balance there should be with the science or the clinical expertise. For me, best practice is not just publications, it's the balance between the clinical expertise and, of course, what we know from science on a certain modality. And I think that got my interest. That's my passion, to know more about that. And the more I go into it, the more I understand that there is a lot of unclarity in this world, especially now that all those modalities have been picked up by the biohacking world.
Yeah.
And the biohacking world is a very special world. And so when I talk with people like you, I want to go a little bit deeper than just red light is good for this and this and this and this. Okay. I would like to understand which kind of red light, what needs to be, or what are the criteria for technologies to be on the market, or what should be the criteria. And I think, to be honest, that is missing, especially in the world of biohacking for a big part.
Yes.
And the world of biohacking, of course, it comes from, in a certain way, it comes from the US. And that's a big difference between US and Europe. In my opinion, in the US, you have a lot of those applications, company driven and popularity driven. So a company gives it to a celebrity or a high level athlete, and everyone will use it because the high level athlete and the celebrity is using it. This is impossible to do it this way if you do consulting in Europe. If you go to clubs in the UK or wherever, even in France, the first thing is, where is the evidence and the clinical expertise? So it cannot be just company driven or popularity driven. And so I like to be there in between. That's my introduction.
Thank you very much. And that kind of leads into the first question. And we've spoke at lengths about this. I've sent you a ton of questions. You've been very kind to always answer and be responsive to them, even if some of them seem very dumbed down. But in your experience, I'm sure you've come across a few misconceptions about peak performance recovery that you wish people understood. You made mention that the technical aspect of these types of machines and modalities. How do you address this in your work? We spoke about previously one size fits all with cold water immersion. Some advocate full body, some only advocate up to the hips. You made mention that you would love to know what type of red light or the frequency of red light. So what misconceptions have you come across that you feel are important to address immediately before it becomes very out of hand?
Well, an easy misconception, if you go to the trigger of cooling, okay? In recovery, the cold water immersion, the cryo chambers. Which one is the best? It's not even comparable. And that has nothing to do with, to be honest, with all the publications. That just has to do with the laws of physics. Also, the laws of physics apply. If you go in cold water immersion, it's about conduction. If you go in a cryo room, it's about convection and radiation. So when it's already common sense that if you want to recover after an intense training and you want to recover and you want to have muscle recovery, then you need to use a cooling modality that can have an impact on muscle recovery. And so there's only one, which is cold water immersion, because it's conduction and it can extract heat from the body, so it can lower the muscle temperature, which the cryo chambers cannot. Now, I know that somewhere there were some people that pretend that even with cryo chamber you can reduce the muscle temperature, but that is impossible. The session is too short, and again, the laws of physics that apply cannot extract enough heat from the body to bring down the muscle temperature. So this is just an easy to understand misconception.
Despite
and so there are many more of those things that don't even have to do with publications and research. Sometimes it has to do with common sense. Okay?
Yeah.
And so which one is the best depends on the goal that you're aiming for. And so it's all about clinical decision. As a physio or a recovery specialist or a personal trainer, it's all about the clinical decision. So I need to know cold water immersion, the laws of physics, and I need to know cryo chambers, the laws of physics. And then I already know I can make already a very easy decision which one to use.
Perfect. Is that even the argument might well be, and common sense should come into this, but one might argue, well, the cryotherapy goes to minus 140. Surely that can have a benefit over a cold plunge that is only 3 to 5 degrees?
Yes and no, because even if the room is minus 110, first of all, then we comes to the technologies specific of the cryo chambers. Most chambers that pretend that they have minus 110 or minus 150, they don't have it. Yeah. I'm sorry to say, we tested many of them with healthy volunteers and with sensors in there. They don't have the temperature that they say they have. There are chambers on the market that do. The big rooms that are very big rooms, very big cooling technologies, they do have, with the 1 or 2 pre-rooms, they do have a stable temperature of minus 110. That is true. But most of the single person units, they don't, because you open and close the door and you lose the cooling air. So that is already one thing. The second thing is cryo, in my opinion, whole body cryo with cryo chambers has nothing to do with the room temperatures. It has to do with the efficiency that this room is reducing the skin temperature in a very short time of a large skin surface. Because we do now, and that is science, we do now, that is based on some publications done in INSEP in France, where they have seen that to trigger the physiological responses or to optimize triggering the physiological responses, it's about cooling the skin temperature to a certain level. And so even though I can understand that the industry is pretending it needs to be minus 110 and minus 120, it doesn't really has to do with that. That is one thing. And again, even though you have a chamber of minus, let's say 90, compared to water immersion of even 7 or 8 degrees water, the physiological or the laws of physics play such a big role that it's not comparable. So with a cryo chamber, you can reduce the skin temperature, whereas with cold water immersion, you can reduce the muscle temperature and even the core temperature, okay, if you stay in very long. Okay, so you see already the difference, and that's again a misconception. So to me, it doesn't have anything to do with the temperature of the room. It has to do with the efficiency of that technology, of that cryo room, on how it can reduce the skin temperature of a large skin surface in a short time. However, there are certain rooms, and I don't want to go into the companies, but there are certain rooms where you can reduce the skin temperature even in 45 seconds. But it's also the balance of the cold exposure, how long your body is exposed to that cold area, because your hypothalamus needs the time to react. So even though we don't understand yet exactly what is the ideal cold doses, that's what I call it. The cold doses is the temperature of the skin that you want to create in a certain time frame that we don't know yet. We know it needs to be short to trigger those physiological responses, but if it is too short, like certain cryo rooms, 45 seconds, then your body doesn't have the time enough to react. So it's finding that balance, and I think science isn't yet clear about that, but we know you need to find that balance.
And with the two, cryo and cold water immersion, and perhaps there's many different reasons for why one would be recommended cryo over cold water immersion and vice versa. But just briefly, who would be best suited for cryotherapy over cold water immersion and vice versa?
That's a good question. I think when it comes to sports recovery, as we just mentioned before in this podcast, I think cold water immersion would be the way to go for recovery after trainings, and indeed to have an impact on the muscle temperature and the recovery of the DOMS effect, for example, etc. However, if it would come to health conditions, then I think cryo chamber has its place, because we know that the endorphins and the norepinephrine are released when being in a cold room, and so indeed there is a certain support of the immune system when using a cryo chamber, which there also is with cold water immersion, but in a different sense. However, it also has to do with how can you apply it, because cold water immersion and cryo room is completely different how to apply it, meaning there is definitely a difference in investment. So it's not always available for everyone. We all know that cold water immersion is a much smaller investment than the cryo room. So it's, in a certain way, it can be more available. That is one thing. Another thing is that there is a bigger hurdle to go in a cold water immersion tub than into a cryo room. The buy-in in a cryo room is easier than in a cold water immersion tub. Okay, of course it's more expensive. Okay, but the buy-in is easier. So there are some differences. It depends. For me, the choice would depend on in which center, which organization. There, I think I would make the differentiation of either putting a cold water immersion tub or a cryo room. If it comes to general patient population, I do believe that there is a good place for the cryo rooms, but also for what we call water immersion, but for different purposes. So if it comes to health support, clients with a lesser immune system, if available, I would choose the cryo chamber. If it would be for sports recovery, definitely I would go for cold water immersion. Yeah. Nice. So that's where my choice would be. Yeah.
I think this then, which I learned this from yourself, and you cited many different research for this. Let's take cold water immersion. It's not a one size fits all. There's many different characteristics of an individual that you have to take in consideration, and you taught me this. Perhaps do you mind just sharing what type of characteristics would have to take into consideration, how me and you perhaps wouldn't be advised to do the same temperature, same duration, your dose, as you call it. Do you mind just briefly touching and alluded on that?
Well, I think, first of all, before to go into that, we have to talk about the principle of hormesis. Okay, the principle of hormesis is very simple. Okay, hormesis means we want to set something in motion, which is beneficial responses. That's what we want to set in motions. It's not, it's dose responsiveness. Okay, so the Arndt-Schulz curve is playing a big role when using any kind of environmental trigger, which is cold water immersion or a cryo chamber, and the outcome is individual. So it means that we all have, first of all, there's already a big difference between males and females, and that has to do with the thermophysiological profile of both of us, males and females and males. It's just different. That is already one thing. It also has to do with the constitution of an athlete or a client. You can understand that rugby players or American football players or have a different constitution than marathon runners. And so when we want to have an impact on a thermophysiological impact, let's say in case of cold water immersion, actually cold water immersion, we want to extract heat out of the body to lower the muscle temperature, then you can understand a rugby player is quite different than that marathon runner. So that is something we should take in consideration as well. So the kind of athlete or the kind of the client that we have in front of us, there are also you say it, differences in different people, in different races. We know that, okay?
Skin
People,
type, right?
Asian people are different than people here from Belgium. So that is something, and that in many times we can take in consideration. Age, is something we have to take in consideration. At my age, my thermophysiological profile is changing that I had 30 years ago. That's just the way it is. The skin quality is changing, and the skin has a big impact. And then we also know that the skin types have a big impact. People with darker skin, we must be, for example, in a cryo room, must be much more careful with people with darker skin because they have a tendency to burn faster, to have frostbite easier. So that is also a characteristic that we must take in consideration. And then the conditioning level, high-level athletes, or athletes that are trained very well, have a very good thermophysiological profile. Their metabolism is different than people that never do sports or never do any kind of movement. So to make a summary, gender is making a difference, skin type is making a difference, the fat percentage, BMI, height and weight is making a difference, because you can understand that for cold water immersion, you want to pass the skin in the subcutaneous fat layer. Okay, for cold cryo chambers, you don't have to pass. You just need to reduce the skin temperature. So that's also a parameter that we have to take in consideration: age and conditioning level. I think those are the main characteristics when using cold water immersion, or even a cryo room, or even a sauna. Don't forget, because when I go into a sauna, we know now that if you want to have cardiovascular health benefits, or health benefits for people that have diabetes, etc., then your core temperature must increase to a certain level. It can be 0.5 degrees Celsius, it can be 1 degree Celsius, or 1.5 degrees Celsius. And so when you're into, let's say, an infrared sauna, your core temperature will increase, but it's different for each one of us. So the duration of a sauna session should be different for each one of us if we want to reach a certain benefit based on, and that is science, the known core temperature increase that you should have to have such a health benefit. So you see, but that is hormesis. Those are the principle of hormesis. No.
And for my interest, how would you monitor skin, muscle, core temperature in both the sauna, if you have done, I'm sure you have, or you had studies that have, and also in the cold water immersion or cryo, just for my interest, actually?
Well, that's a little bit more difficult to do, because we have now, as you know, there are sensors that you could put on the skin that have a correlation with the core temperature. The problems that we see, such a skin sensor works very fine if the heat is produced from the inside. Okay, let's say you start running, your core temperature increases, and then you have such a sensor. It works very well, very accurate, and those methods are validated quite well. However, if you start using environmental triggers, they come from the outside. So a sauna, heat comes from outside, cold water comes from outside, and then the body reacts by either decreasing or increasing the core temperature. And then those sensors don't work that very well. So for those purposes, you would need, those core pills that you can ingest, and then you have a very accurate, how you say it, measurement monitoring of the core temperature. But it's something invasive, and it's something that you cannot do in daily practice. So it's a little bit more difficult to have a good approach measuring the core temperature increase or decrease when using an environmental trigger from the outside. That's what we have seen.
That's a good point, because I do use them sensors, and I never looked at it that way, actually.
Yeah. Yeah.
Mostly outside, mostly outdoors when I'm training.
Yeah. So then they work fine when you're outdoors and you're training, because your core comes in, the core temperature increases from inside. Okay, but now the cold comes from outside in your cold tap, and then you have your sensor somewhere on the body. It doesn't
create a
if
short
you then
circuit.
correlate it with if you then correlate it with the pills that you would take in, it's not always in balance. Let's put it this way. So that's where I
in your career, have you ever had to challenge a widely accepted health or performance practice that you initially believed in, that led a shift in this perspective? So was there something that you did believe in at one point, but for whatever reason, maybe it was a client's results, a patient results, that you then questioned it and perhaps challenged the status quo of some sort? Do you have anything that you could share here?
Yeah, definitely. So I told you, in the beginning, I come from the beginning of the 80s, end of 70s, beginning of 80s, and that was the stretching age. The books from Bob Anderson, and everyone started stretching. So we really believed at a certain time that stretching needed to be done before competition and after competition, and that it would solve all our problems. Now we do realize that there are different ways of stretching, or different ways of increasing mobility. Let's put it this way. And that mobility in certain sports is important, but in other sports it's less important. And it's sometimes the balance between mobility and flexibility, but also limited mobility. So this thinking of flexibility as we had many years ago is completely changed. So that is completely changed, and so you have to adapt at certain moments, and that's why I say even your profession evolves, and it's so important to be not only to read, but to follow courses, to talk to colleagues, to talk to athletes, because most of the things that we evidence is always running behind clinical expertise. We forget that everything comes from clinical expertise, and then once we see that something works, the scientific world will prove right or wrong. Okay, so yes, there are different approaches when it comes to ACL rehabilitation, for example. I think we have a complete different way of thinking even than 15 years ago. Okay, so should everyone with an ACL injury undergo surgery? I think there is a big way of reasoning behind that. So I think in every profession there are changes. However, what has not really changed, but still is kind of unknown or not really understood, is, and I go back to the hormesis principle, is that it's not linear, meaning more is not always better, and that is something which is somewhere in the mind. And I talk specifically about athletes. Athletes think the more is always better, and it must be higher, and it must be more weights, etc. But we know now that there is a certain, ideal dose, as we say, when it comes to weightlifting, when it comes to cardiovascular workout. We now since many years we have our heart rate zones. And that is not really understood now, coming back to the world of recovery. That's why I say it's not always longer and colder water that you need. That's very specific with hormesis. There is a certain dose, and if you go beyond that dose, you will have, instead of an optimal recovery, it will have an inhibition of your recovery, and even at a certain moment, it will hurt your body. And I always compare it, if you always go running in the red zone of your heart rate zone, always red, your condition will go down. If you stay in the cryo room always too long, you will risk of burning your skin. So that element of it's not linear, that is something which already understood in the 80s, but still not really understood by athletes and sometimes by physios and even performance coaches. I think we're getting there, but yes, there is a big evolvement, as you ask, within my profession. Things have changed. Things have more been in. We can work more in detail with certain elements. We didn't have core temperature pills in the 80s, so we had to do it in another way.
Yes.
So yes, evolving, and I think my professional career is in a certain way past, in a certain way, but I think it's for colleagues and for all the colleagues important that we keep up and that we're also able to change ourselves, because I think that is the most difficult. As an individual, you get, how you say, you get rusted in a certain way of thinking, and so once that happens, it's very difficult to accept new ideas. I think that is what it's all about. Yes, new ideas, open ideas. In performance training, the velocity-based or training, which is now, it's not completely different as before, but there is a different mindset. So yes, I encountered certain, how you say, aspects in my profession that that are changed, and yeah. So.
Perfect. That leads nicely onto the next. So, can you share a moment when you saw a client, patient, or athlete achieve something you initially thought was impossible? You made mention of an ACL injury and how you might perhaps recover from that might be different now to what it was in the past. And if you did have an athlete achieve something that you initially thought was impossible, how did that experience influence your work?
Well, yeah, I think now if we talk about athletes, and especially high-level athletes, one of the specific characteristics of most professional athletes is their mindset, is their will to achieve something, is their determination. Okay, which you don't see always with a regular patient. Okay, and I think that's of course what how you say it, what makes elite athletes different. So I've worked with several elite athletes in professional tennis and basketball. And yes, there were some athletes that where I said, okay, coming back, it's easy. Coming back from an ACL injury, if you go to the orthopedic surgeon, they say, we do surgery and you'll be back. But we all know that's not true. I had one athlete from a posterior knee ligament injury, a PCL, which is much more difficult to come back. It's almost impossible to come back. And this was an athlete, a basketball player, who won the playoffs here in Belgium with his team. And when they won the playoffs, they had a celebration, and he drove home. He drank a little bit and had a car crash, and then he had a dashboard injury. And with a dashboard injury, it's your PCL that tears, not your ACL. And so he had 6 months of rehabilitation somewhere with a colleague of mine, and it was impossible to return to his normal level, just impossible. So when I saw him the first day, his laxity was enormous, and I really thought by myself, this is impossible to return at your professional level. And we started working for, let's say, I think 3 months, beginning of the season. Or pre-season. We worked 3 months every day, 7 days on 7, 2 to 3 sessions a day. I worked with him, but his mindset was so unique that he started to be able to control what we call the intermuscular coordination of the knee, because that's what it's all about. Even with the PCL, you can have surgery, but the instability in many times stays. And so that instability with every movement you do, especially on a basketball court, your specific movements of cutting and jumping. But he was, by a wonder, slowly able to control his knee muscles so extremely well that after 2 months, I really thought, I got the impression maybe this athlete will be able to make it, to get back after PCL surgery, and all colleagues will know how difficult that is, to his previous level. And after 3 months, when he played his first game, or he sat on the bench when he played his first game, when he came up for only for a few minutes, that to me was in a certain way a wonder, because I've seen him before, I've seen him after 3 months, and it has nothing to do with me. I can give the guidelines to the athlete. And I do understand that there are egos in athlete sports, there are egos in orthopedic surgeons, there are egos in performance coaches and with physios. It had nothing to do with me. I gave him the guidelines. It was his mindset that brought him back. And he played another 2 seasons, which was a wonder. I still know him very well. He wouldn't be able now because he lost the control of his knee. But to me, that was something that will always stay with me. And again, I think it has to do with mindset of elite athletes that can do things that just a regular person is not able to do. Okay.
No, fascinating
So yes.
story. Fascinating story. Wow. After 3 months, he was returning to play.
It was a victory for him. It was a way for me, not a victory. I don't know. I was sitting on the bench as a physio, and I saw him play, and I really got something from yes, this is just a wonder. To me, it was a wonder. It was more a wonder, but it means that, again, if you have determination, you can achieve something in your profession, and you can achieve something for you as a performance coach or as a recovery specialist, and for this player as an athlete. And I think that's what it's all about. I think that's what makes elite sports and being in elite sports so different than the normal, the normal world. Let's put it this way.
Yes. I think I know your answer to the next question, but and you might tell me that actually I wouldn't know, because I need to know what's in front of me before I design this. But if you could design the ultimate health and performance protocol for a completely unregulated world, no constraints of time, legalities or ethics, what would it look like, just out of interest?
You mean health and performance when it comes to the equipment or the idea?
I think equipment. When I was thinking of this question for you, because I know that you run centers yourself, you have access to these modalities. If it was something that you could perhaps prescribe to everybody that they should do at least once or twice a week, or how frequent you recommend, is there a particular order that you would do? A red light, a cryo, ice bath, a sauna? Would you keep them separate on separate days?
Now, what I would do is, and what I do here in my lab, is when someone comes in, I make a profile. I make a profile of the person, first of all, to understand where he comes from, what he desires, and especially also the contraindications, when not to use a modality. I think, to me, it's always been that. If you do manual therapy and you do manipulations, etc., it's not, the most important thing is not to know which kind of manipulation you can do or when to do it. It's which kind of manipulation not to do in certain cases. Okay, so that is one thing. The profile of the athlete or the client that comes in. That will already make me understand which kind of modalities I cannot use. Let's say I have a client, which I had the past week, who is undergoing chemotherapy, for example, and has certain antibiotics or certain medication. Certain medication can make you much more sensitive to light. Then you're not going for the red light therapy, okay? Even though we know that red light therapy, where the photons are reaching the mitochondria and the photons are then changed into ATP, increased of ATP. But in this case, I would not prefer it for this. So you see already the profile will guide me to this client or this athlete, okay? What not to do, okay? And then based on that profile, we do a certain health analysis. It's done with a health kiosk. That health kiosk can give me a certain number of indications of his health at that moment, of his of the way I can put a certain load to this client, okay? A cardiovascular load, microcirculation, stress, fatigue. So together with my intake consult, getting to know the client, and the health analysis, getting to know the indications in relation to what I explained to you just now, then I can make a certain strategy, periodization, how you want to call it. For me, it's a strategy that I can advise to this client based on this.
Mhm.
Because I want to create value, because it all costs money. And so to me, it should be when I give an advice, it should be a certain value where he's going to pay for. And that value should be specific for this client or this patient or this athlete. And so then I would say, maybe for you it would be better the hyperbarics. Maybe for you it would be better the compression therapy. Okay. Maybe for you it would be better cold water immersion. So that's how I would advise it. Of course, also depending on what is available. Okay. I have the luck in my lab to have almost everything available. Okay. But I can understand that there are organizations or clubs or centers that have fewer modalities available. So that's also, I will put it in the available modalities, and then I will advise a certain strategy in a certain frequency. Okay. And also the frequency is important, because that also we know, and I come back again to hormesis. What does it make sense, or is it going to increase your condition if you go out in the woods once for a nice run? Okay, no, you need to do it in a certain frequency. You need to give your body enough time to adapt to this trigger that you give. So that would be for me the same. I would give a certain advice based on the modalities in a certain frequency, and then maybe for one modality going to the next. I'll give you an example. Okay, we do a very simple MIP test, which is a test that analyzes in a very simple way the quality of your inspiratory muscles. Okay, so it gives you an idea if especially your diaphragm, which is an important inspiratory muscles, and your muscles between your rib cage, if they're still of good quality. So let's say this client comes in, and I already would see that the quality of the inspiration muscles is not as good as it should be compared to a benchmark, which is many cases the situation. Then I would advise to do for a few weeks some easy training for the diaphragm against a moderate resistance, because if you increase that quality of those inspiratory muscles, you already increase your rib cage and you increase your vital capacity. You make your diaphragm move much more up and down, especially down. And the diaphragm has a big influence of all the organs, especially your kidneys, that lie beneath. So this already would be a value for this client. Then you can understand, if you increase those muscles and you increase the vital capacity before going into intermittent hypoxic training, or before going into hyperbaric chambers where you need to inspire. So you can see already that's common sense. No one has to come to me with a publication or research that if your inspiratory muscles work more optimal and your vital capacity and open your rib cage is broader, is bigger, that then the result of those trainings with hyperoxic or hyperbaric would have better result. It's just common sense.
Yes,
okay.
Yes.
And another thing, for example, let's say you would have someone with a health condition, because you asked me how to reason. If someone would come in with a chronic health condition, we know now that at cellular level you have your mitochondria. Someone with a chronic condition, it means that a percentage of the mitochondria has lost their function. Okay, something that can be measured nowadays. So to me, it would make more sense to do intermittent hypoxic intermittent training, because that is known by science that it can regenerate those mitochondria that have lost their function. So, but you can understand that once you have a higher percentage of healthy mitochondria, that then your hyperbaric training would make more sense, because hyperbaric is oxygen into the blood going to at cellular level to the mitochondria, which then changes it into energy. But if a certain percentage of your mitochondria is not functioning again, then I think it's common sense that I would choose for intermittent hypoxic oxygen training before going to hyperbaric oxygen training. Now, if a healthy person comes in, a high-level athlete, then we're not talking about a health condition. Then I would go immediately to hyperbaric, 9 out of 10.
Yes.
But you see the reasoning behind. Yes. And I think that is a little bit lost or forgotten in the biohacking world, to be honest.
No, I agree.
Okay. And so that's the way I see it. Let's put everything together. And I don't say I know it all. By far I don't. But I try to use principles of hormesis, common sense, and safe technologies that do what they need to do. Okay? I'll give you an example. I cannot understand that there are still on the market cryo chambers working on liquid nitrogen. I just can't. It's dangerous. They don't reduce the skin temperature the way it should. And you start inhaling nitrogen each time you do it. So why this is again industry driven? Okay, I make a chamber. I always say I had a video meeting with a high level football club in the UK, and I said, I'm sorry to say, liquid nitrogen, it's good to freeze pizzas and dead chickens, but it's not supposed to be used on human beings. I'm sorry to say, it's not. And so you see, all of that, I hope that the world in the future, the biohacking world, also start reasoning this way. When to use. No, client comes in, go in the red light therapy room. Yeah, but
what reason?
Why?
Yeah.
Why? When? Yes, I believe in red light therapy. I believe in cold water immersion. I believe in cryo rooms for their purposes. Okay.
No, thank you for sharing that really in-depth answer to that. And I like the idea of, first and foremost, considering what you should remove first and foremost before deciding on.
I think it's important. If you work with an athlete as a performance coach, you first need to have a profile of your athlete and to understand which kind of exercise you can't give him yet, because they're going to hurt him. They're not going to increase his performance. The same with rehabilitation. I want to know the profile of my athlete and what kind of exercises or modalities he can use or not yet. Maybe it's too soon. Maybe I have to. So it's always the same. But make a profile, and therefore the intake consult, a good intake consult. And I think listening to the client, listening to the patient, listening to the athlete, that's where it all starts. And then it will also give you as a professional a certain credibility. It's all about credibility. Does the athlete or the client believe in you? And that is done by listening first. I think also that's a little bit lost in, I do believe in general medicine. But I do believe also that in general medicine, listening to the patient is lost a little bit. The client comes in, I have a flu, okay, I'll give you this medication, but maybe the cause is somewhere else.
Yes.
But that takes a little bit more listening and understanding. And I think that's where we will go to a more holistic approach in general, but an approach, especially as you say, I don't want to harm the client. And if I don't want to harm the client, technology, know what not to do with the client. That's the first thing, not hurting the client or the athlete, and then trying to create something that benefits him for his situation.
Nice. Thank you, Pat. I think we should stop there. I've gone over the time. I knew we would do, knowing it's yourself. So great answers to the questions that we've asked. So thank you for that. And thank you for your time.
You're welcome, Joe.